Welcome to the CountryWatch Political Intelligence Briefing Quick Hits, a weekly briefing of hot stories across the world in brief. I'm Denise Youngblood-Coleman, and I'm the Editor-in-Chief and Senior International Affairs Analyst at CountryWatch. This week, India is the featured country. In India, coronavirus infections have surged and the country is in serious trouble. There are at least 300,000 new COVID-19 infections every day, and close to 18 million cases of the lethal virus have been registered. The daily death toll has been climbing to above 3,600. The official number of total deaths has climbed to a devastating figure of 200,000, but the real number of fatalities was thought to be far greater, since mortality data in rural India can be sketchy, and many deaths are not officially recorded. Hospitals are contending with a surge in patients that overwhelm the system. Furthermore, the surge in patients places a strain on hospitals' oxygen supplies. The Supreme Court of India has made clear to Prime Minister Narendra Modi's government that a national plan for both the oxygen supply and life-saving drugs are required. The blame for the surge in COVID-19 cases can be partially laid at the feet of Prime Minister Modi. In March of 2021, he bragged about India serving as the world's pharmacy in terms of supplying vaccines to other countries. But this claim came at the same time as coronavirus cases in India were beginning to surge at alarming rates, and also as his health minister claimed that India was nearing the end game of the pandemic. Further blame could be placed on Modi for ignoring scientific warnings not to participate in election rallies. In fact, the Prime Minister held political rallies that attracted an estimated 3.5 million people, clear superspreader events. He also permitted a massive Hindu festival to take place in northern India. Indeed, millions of Indians were in attendance at the Hindu festival, the Kumbh Mela, which concluded earlier in the month. Other factors contributing to the spread included thousands of unmasked people attending a cricket match between India and the United Kingdom in a new stadium named after Modi. Finally, Modi encouraged the states of India to shun lockdowns and view them as a last resort. For these reasons, the Vice President of India's Medical Association, Dr. Navjot Dahiya, characterized Prime Minister Modi as a super spreader who had tossed all COVID norms in the air. Yet rather than focus on improving its record, the government sought to defend itself and tamp down criticism. Of significance was the fact that Health Minister Harsh Vardhan defended the government, claiming that India's fatality rate was the lowest in the world and that oxygen supplies were adequate. Also of significance and some alarm was the fact that the social media outlet Twitter was asked to remove tweets expressing criticism of the government. But on April 30th, 2021, India's Supreme Court defended the rights of Indian citizens to convey their grievances and to ask for assistance using social media. In summary, despite originally looking like India had avoided a major crisis, both political leaders and the population have become complacent regarding masking up and social distancing, ultimately leading to a surge in cases as well as the emergence of new variants. Meanwhile, countries from across the world have been sending urgent medical aid to India to help the country deal with the COVID-19 disaster. At home in India, there has been an effort to ramp up the rate of vaccinations with a massive vaccination drive. That massive vaccination drive seemed more aspirational than actuality, with less than 10% of India's population receiving an initial dose by late April 2021. Also problematic and ironic was the fact that the country that was touting its leadership in vaccine manufacturing might not be able to meet its own demands. A similarly horrific situation was playing out in Brazil, where the battle with COVID-19 was characterized as a humanitarian catastrophe by the medical aid organization Médecins Sans Frontières, also known as Doctors Without Borders. The COVID-19 daily death toll surpassed 4,000 deaths earlier in April, with the total number of deaths in the country approaching 400,000. Médecins Sans Frontières assailed Brazilian authorities for their refusal to adopt evidence-based public health measures. A significant portion of the blame for how Brazil has responded to COVID-19 rests on Brazilian President Jair Bolsonaro's shoulders. Throughout the pandemic, he has deemed safety measures such as lockdowns and social distancing and he's also spread conspiracy theories about the COVID-19 vaccines and promoted alternative treatments without proven efficacy. At a Senate inquiry hearing on May 4th, 2021, former Brazilian Health Minister Luiz Henrique Mandetta said that President Bolsonaro had repeatedly ignored warnings about the fact that his response to the coronavirus pandemic risked the collapse of the country's healthcare system. Mandetta, who resigned in April of 2020 after disagreements with the president, declared, "I warned him systematically." Moving on to Italy, where a year after its first national lockdown to fight coronavirus had gone into a second one, it was turning the page for the better. As April 2021 came to a close, the strategies implemented a month earlier had proven successful. Italy was reopening with students back at school, restaurants and bars opening, and some outdoor events allowed. Nevertheless, a curfew for the late evening hours remained established, as well as the mask wearing mandate. In Spain, a year after the peak of the pandemic, the focus was on vaccinations and tourism. As April 2021 came to a close, Spain was reopening with restrictions being lifted in certain regions and restaurants and bars easing back into business. As well, the government said that as of June 2021, international tourism would be resuming. With a pilot trial of digital health certificates at airports to ensue in May of 2021, Tourism Minister Fernando Valdez said that Spain would be ready to use COVID passports in June. In France, after the alarming rate of coronavirus infections deeply pressured the system, the country began to see some light. By late 2020, April 2021, France was coming out of its difficult struggle with the lethal pandemic and starting to ease out of lockdown. Primary schools had reopened starting in May, some travel would be allowed, and secondary schools would reopen, while in mid-May, every expectation was that businesses, restaurants, cafes, and cultural venues would reopen. The curfew was scheduled to be lifted in June. Now on to Germany. By the start of May 2021, Germany had implemented a new lockdown law that empowered the government to impose overnight curfews and shut down schools if infection rates increased at a concerning level. The reality was that several large cities, including Berlin, Munich, Frankfurt, and Cologne, already reached those benchmarks. The lockdown law was expected to remain in effect until the end of June. In May 2021, new emergency laws were implemented in Sweden, empowering the government to impose coronavirus restrictions. The country that had embraced the notion of herd immunity and had avoided implementing such rules was now set to establish limits on the number of people permitted to be in businesses, shops, restaurants, and cafes. As well, citizens would be asked to wear masks when indoors in public spaces and on public transport. Finally, in the United Kingdom, as the lethal pandemic began to ease in Europe, and at the start of May 2021, Prime Minister Boris Johnson of the United Kingdom announced that international leisure travel could resume on May 17th. The actual destinations across the globe would be color-coded according to risk categories and would determine the testing and quarantine requirements of citizens returning home. The government was also developing a digital vaccine status system intended to aid with international travel. For more information about these and other stories, read my weekly political intelligence briefing and my coronavirus report, both of which are accessible from the front page of the CountryWatch website at www.countrywatch.com. Thank you for your time. Have a great day. And remember that we live in an interconnected world.